Hi guys, let's talk about intermittent claudication. What is this intermittent claudication? Now, this is a condition that is usually seen in chronic arterial disorders. So, what is this intermittent claudication? Let's understand this, right? Now, let's say this is the path that our patient is going to take on a regular basis to the office, right? Now, let's say this is our guy. Now he says, when I'm standing at rest, that means he's not walking. When he's standing at rest, he's absolutely fine. He's all smiley and lovey-dovey, right? Now he says, as I start to walk, now he starts to walk, and this is the point where he is taking a good walk, and after walking for a certain amount of distance, he feels there is some amount of pain. Then I say, what did you do? He says, sir, मर्द हूँ, मर्द को दर्द नहीं होता और मैं चलता रहता हूँ, right? So he says, I walk even though there is pain. So this guy continues to walk with pain. But after walking for a certain amount of distance, he realizes कि मर्द को भी दर्द होता है और दर्द ज़्यादा होता है, and this is the point where he decides to stop due to pain. I said, अब रुक गया तो क्या करेगा? He says, the pain becomes so unbearable that I go and find a nice trunk of tree, and under the shade of this tree, I just go and sit down. So he says, I go and sit under the tree, and I say, then do what? He says, I reach out to my pocket, get to my best friend, light him up, and the minute I light him up, I feel the best happiness is here. Now he says, I sit down and I start smoking and it feels better. Now his analogy is, at the start point, the patient is happy because there is no pain. But after walking for a certain amount of distance, this is the point where the patient complains of pain. And this is the point where the pain becomes unbearable. So he's going to rest due to pain. So if I say that at rest, the patient remains asymptomatic. The patient remains asymptomatic, right? After walking for a certain amount of distance, this is the component where the pain appears. So pain starts after walking for a certain amount of distance, and then I say what? He says, I continue to walk with pain, but there's a point where the pain becomes excruciating, so the pain shoots up, and this is the point where he stops due to pain. Now he stops due to pain, and then he is going to rest. Now when he rests, what is going to happen? The component of pain reduces, and this guy says, at the minute I light up the cigarette, I find it very happy. So he is trying to tell me that smoking is relieving him of pain. This idiot does not know that it is the chronic arterial occlusion. As patient starts to walk, what happens in a chronic arterial occlusion? At rest state, the circulation that is going via the collateral is enough to maintain the metabolic demand of the tissue. But when patient starts to walk, oxygen demand increases. The supply will not be able to increase according to the demand. Hence hypoxia, ischemia, and pain. The minute he rests, again the metabolic demand decreases. Hence pain decreases, right? So this on and off. That means at rest there is no pain. Starts to walk, develops pain. He rests, pain drops again. Again he'll get up, he'll start walking. Again after walking for a certain amount of distance, patient pain will reappear. This on-off mechanism is what we call it as intermittent claudication. Now what is the claudication distance? It is the amount of distance a patient can cover, or the amount of distance a patient can walk before taking rest due to pain, and this is what we call it as claudication distance. Now the claudication distance, again a very important concept. What is a claudication distance? It is the amount of distance. It is the amount of distance a patient can walk. A patient can walk before taking rest due to pain. Before taking rest due to pain, and in fact I can say the claudication distance is inversely proportional to the severity of the disease. That means more the claudication distance, less severe the disease, less the claudication distance, more severe the disease. Obviously a patient who is able to walk for 500 meters and sits, and a patient who walks only 50 meters and sits, who is having a more severe disease? Obviously the one with the shorter claudication distance, right? So this is the concept of intermittent claudication, on and off. Stop smoking.